Hello, I'm Dr. Saurabh Joshi from the Vein Center, and today I'm going to talk specifically about my patients who are more than 70 years of age and have a non healing wound on the leg. Now, treating venous ulcers for an elderly patient more than the age of 70 has some specific issues as well. Not only do we have venous reflux or the varicose veins which causes the wound, and we've been having this for a long time. Probably your mom, dad, or your grandparent who has having this wound has been having living with these symptoms for decades, probably 2 or 3 decades, and they might be complaining of pain in the legs and swelling. Legs become heavy when they sit for a long time, and this progressively worsened the quality of skin on the legs, and now they've come with a wound on the leg. Usually, a 70 plus year old patient tends to live with a wound for a long time before they actually seek help. They must be doing dressing for a long time, and this all makes the wound a chronic non-healing ulcer. That is a wound that doesn't heal for a long time. In addition to this varicose veins, there are some other issues as well. Most elderly patients have reduced muscle mass. That means the protein in their muscles is less. They have lesser immunity. Probably they might have some other health issues going on as well, like diabetes, blood pressure, or kidney diseases. They might have some orthopedic conditions like a knee problem, like a back problem that prevents them from walking properly, and all such issues. Even nutrition, they might not eat properly, they might forget taking their medicines, the protein intake might not be that great. All these things bring together to form a mix of things where wound healing is already slowed down. If your loved one has such a wound on the leg, they need to see a vascular doctor and to do a venous Doppler ultrasound and find whether they have this varicose veins or not. If they do have varicose veins, they should be treated for varicose veins. Currently, there are ways to treat an elderly patient without giving them full unconsciousness or giving a needle in the back. These are cyanoacrylate based methods, one which is VenaSeal. Now, in such a condition, at least we don't increase the risk of anesthesia related issues for such a patient. In addition to that, that's not the end of the story. You see, unfortunately, in such an elderly patient, they need good supportive care. Doing the procedure is not the end of the story. We need to have make sure that our loved one gets the right kind of supportive care that is needed. If they have a wound on the leg, they need to have good proper compression dressings. Sometimes they don't tolerate dressings very well, so they might feel that the dressing is too tight, and they won't allow you to do the dressing. For that, there are various types of dressings, and dressings can be made lesser compression ones, the one that suits the patient better. Nowadays, we have a wound care team that visits the patient's house, especially if you're in Mumbai or in nearby areas, and that's how we help you actually give better care to the patient. You need to make sure that their sugars are under control. If they are not on a proper protein rich diet, then you need to make sure that they have good amount of protein in diet. And after knowing their status of kidneys or other issues, ideally a patient with a chronic wound on the leg needs to have at least 1.5 grams per kg body weight of protein. That would help the wound heal. Now, the wound healing would also depend on how large the wound is. A larger wound will take a longer time to heal. Is the wound infected or not? And do they have other health issues or not? In addition to treating the veins, supportive care is very important. And please visit your vascular doctor, and hopefully your parent or your loved one should get the right care that they deserve. Thank you.